Hi, I'm Dr. Bojana Jankovic, and today we're talking to Dr. Katie Beleznay, my good friend and dermatologist. And I'm so excited because I get to pick her brain on everything skin related. And the topic of this video is are procedures that one can implement and do for a healthier, younger looking skin that go a little bit beyond your skincare routine, healthy lifestyle, and so forth.
It's a big field with many, many different things that are available. There's everything from microdermabrasion, chemical peels, lighter laser or light-based therapies that might help to improve the texture, the tone of the skin, overall complexion. You can move up from there to things that may help with wrinkles and lines, and so people who have frown lines, for example, or crow's feet, and they may be served by doing a neuromodulator treatment like Botox. And then there are filler treatments, and fillers help with sagging skin, deeper lines. That's where they prove to be most helpful. Yeah, and then there's all sorts of other things, including skin tightening procedures and whatnot, and it is a big field, but there's lots of availability in this field in general.
One of the things that you had mentioned is that with some of these procedures, they really have a preventative effect in a way, and they can really slow down some of the signs of aging. Can you talk a little bit about that, and if there's sort of a window of opportunity that can potentially be missed if someone starts later on in life?
Yeah, and that's a common question. When is it too young to start these treatments? Right. And there's not a great answer to that. Someone who may be in their late 20s but has a deep frown line and wants to prevent that from getting deeper may be a great candidate for botulinum toxin treatment. And so it really depends on the person. We know actually from a number of new studies that have come out and some old studies that intervening early can be preventative. So if you do, for example, a baby Botox treatment for someone who's starting to get frown lines, they may be better served by doing that treatment earlier than waiting until it's already deep and etched in. And that goes for many of the other treatments. If you stimulate collagen and intervene a little bit earlier, it may be preventative so that 20, 30, 40 years from now, you're not sort of catching up per se. So many people come in to see me and say, I don't want to look done and I don't want to look fake. And it is so important to keep that in mind. And so I think whenever you're creating a treatment plan in the aesthetic space, you need to be mindful about making someone look themselves, but just maybe, reducing, for example, that frown line that bothers them.
What is that? What implications does that have on the frequency of treatments? I assume that's also something that's very much customized.
Right. Yeah, exactly. There are treatments like Botox, for example, that typically need to be repeated every 3 to 6 months or so. Filler treatments, it really depends on the filler. There's so many. The hyaluronic acid fillers that people may hear of, like Juvederm or Restylane, or those kind of brand names that people know of, those ones may be repeated every 6 to 12 months or so, depending on the type of product. And then lasers or skin tightening procedures, it's so dependent on the person.
And now, one last question. When it comes to selecting your provider, you're going in and you're going to have this procedure for the first time. What are some of the qualifications or qualities you should really be looking for?
Yeah, I think that's important to really think about because everyone's wanting to advocate for their own health and best outcome, right? I tend to say for the cosmetic or aesthetic field and space, really, first you should see a physician is my recommendation. Someone who's had even extended training or extra training within the cosmetic space so that you know that they understand the important parts. What's the important anatomy that you're treating? How do you go about approaching the treatment in a full sort of 360-degree approach so that they're really thinking about your skin and your skin long term. So I do recommend seeing a physician with those credentials.
Thank you for watching, and thank you, Katie, so much for joining us. And feel free to leave any comments or questions.